Everything is okay until it isn't. One minute, your mom is out enjoying lunch with her friends, laughing, smiling. No one plans for things like this. Families are expected to know everything: medications, her doctors, her medical history, what hospital was she taken to, what happens next. Daughter is in another state, trying to balance work, motherhood, schedules, and now a medical emergency. One phone call can instantly turn an adult child into a caregiving right now. This is where things start to change. Hopelessness, fear, learning that mortality is real. What am I going to do now? Multiple doctors, different opinions, endless appointments, no clear communication. And while everyone is focused on the patient, who helps the family? Adult children are trying to manage their parents' health care while also working, raising families, and trying to hold everything together themselves. And what many people don't realize is discharge planning actually starts at the moment your loved one is admitted to the hospital. The problem is, families are often overwhelmed, confused, and trying to figure everything out alone. That's where family care navigation comes in. That is where I can help. I would like to take a few moments to talk to you about the reason family care navigation is helpful and will benefit you and your family. You see, the challenges of adult children face is that many professionals are suddenly thrown into managing medications, appointments, specialist referrals, discharge instructions, insurance issues, home health care, follow up care, and it can quickly become overwhelming. Some people are trying to coordinate all of this while living in another state or while working a full time job. This happens to so many people. As the case manager, when I worked in the hospital, I would see this time and time again. Sometimes we as case managers can be so busy and bogged down with seeing 30, 40, 50 clients because we have two or three different floors that we're assigned to. When we get a patient in the hospital, we immediately do an intake and we're going to ask about their family, their support system. Do they have stairs? Do they have transportation? Are they having any trouble getting on and off the toilet, in and out of the bed? Are they incontinent? It's very, very detailed. And sometimes your parents are afraid to tell us the truth. Sometimes your parents feel if they say that they need something, someone's going to come in and take their autonomy away or move them out of their home. They usually will start to refuse home care because they believe that if the nurse comes into the home, they're going to find something that they need, contact elder services, and remove them from their home. So they tell us that they have support. They'll tell us that they have a child, not that the child is out of state, but they'll tell us that they have a child that can help them and they have support and they understand their medications because they have an inside fear. And it just happens that, believe it or not, it's really true. And then sometimes we as case managers will put a plan together like safe to discharge at home or safe to discharge with possible home health care. So then there's a system that we use. And we put into this system that a patient may require home health care, and all of these different home health care agencies will come back and say, we'll take this case, or this company will take the case, right? So what happens is we may say, okay, we're going to give you to Home Health Care Inc., and they're going to start care 2 or 3 days after you're discharged. Well, did you know that there's one specific thing that happens before that home health care can take on that case? They're going to send a message to your primary care provider and find out if that primary care provider will manage the case. Because who's going to sign all of the care documents? In order for your home health care company to get paid, you know what happens? The provider or someone has to sign the plan of care. We need to sign the skilled nursing intake. And sometimes if they order physical therapy, we need to sign off on that as well because we need to verify by the state so that insurance will cover it, what the skilled need was, and if continued care is needed. Well, what if your parent doesn't really follow with the doctor because the parent's been healthy until this incident happened. Or maybe the doctor is on vacation and we don't have anybody to take on that case and to say that they'll sign. So then what happens is your parents discharge and home health care never calls. And when you call them to find out, hey, what happened to you coming out to see my parent? They're going to tell you that there's a delay in care, but your mom or dad's already at home. It happens all the time. One important thing families do not realize is that discharge planning does not start the day your loved one leaves the hospital. There are often important tasks that need to happen before the discharge: arranging follow up appointments, making sure medications are correct, ordering equipment before they leave, ordering home health care, making sure providers receive the records. If these things aren't missed, it could lead to confusion, delays in care, or even hospital readmission. So I'm going to give you an example. I have worked with a family that the mother was being discharged from the hospital. The mother was diagnosed with congestive heart failure, which caused her to pass out and become swollen. Okay. She did not tell her family that she was going through this. It's just something that happened, and she only talked to her friends about it. Family members never knew. So then, again, mom was pretty healthy until all of these things happened. She's been taking some vitamins, trying to fix it on her own. So now the mother's discharged. Well, the mother does not have an active primary care because she's not been to the doctor in over 6 months. So the physician refuses to sign the home health care orders until the mother makes a follow up appointment. And guess when that will be? They'll tell you on your discharge plans to see the doctor within, sometimes depending on your discharge, they'll say between 2 days or 1 week. Okay. So now the patient really needs to basically almost reestablish. And the appointment is a month or two away to see the doctor. So now home health care is delayed. Your mother may not understand all of her medications. She may not understand that she needs to weigh herself every morning now. She may not know that she needs to contact a doctor if she gains more than 3 pounds overnight. So what happens? Your mom goes home, everything is fine. 72 hours later, she's back in the hospital. First thing, believe me, hospitals go by something, most of us go by something called press game. And also, we get hit by CMS and or your insurance companies if patients with certain diagnoses get readmitted within the next 30 days. So first, we do not want that. That's how come we have case managers and discharge planners. Now, that's on the hospital side. But on the family side, you're struggling. Now you need to leave work. You probably need to get FMLA. Now your daughter or your child is getting ready to go to nationals and you're wanting to do that so bad. But now you have to make a choice. Am I going to be a proper daughter or a proper child and take care of my parent? Am I going to take care of my family and my spouse? Or am I going to try to balance both and forget about me? Something has to go to the wayside. If you're going to take care of your mom, then it's going to be between 75% to 80% of your time is going to be on that. Or it's going to be, I'm going to take care of my family, and that's going to be 70, 80%, and I'm going to give 20% to my parent because I can call them on my break. I can call them when I get off from work. I can call on my way to work. And what happens? You leave voicemails. And when do they call back? When you're in the meeting. Does that sound familiar? Also, another thing that happens after discharge is the medication reconciliation. Some patients have lots and lots of medications and they see more than one doctor. Well, the patient may have two of the same pill and may not know it. Because believe it or not, when you actually get to your parents' house, I cannot tell you how many times I've had family members bring me in a garbage bag, well, not a garbage bag, I'm sorry, a bag from the grocery store full of pills. Some of the bottles are old, and she says, oh, I kept those just in case I need them. Well, Now you figure, oh, I'm not feeling well. I'm going to take this or I'm going to take that. And now it's contraindicated in some of the new things you're taking. But you forgot to tell the pharmacist and the hospital person that you're taking enalapril. And now they've prescribed you Prenavil. Okay. Or you take losartan and they've prescribed you olmesartan. And you find your mom on the floor because you were smart and you put in cameras in the house. And now your mom is passed out, so you call the neighbor to go over and she calls EMS. Listen, you've got to start taking these things seriously. A pound of prevention is worth an ounce of cure. Isn't that what they say? So you ask your parent, are they taking their medications? And if they were able to pick up the medications that the doctor at the hospital ordered for them. And she tells you, I'm taking vitamins, I am taking some white pills, but I'm not sure what they are. I have two white pills that are thin circles. I have one white pill that's a big circle. I have another white pill that's a little bit smaller and it has black writing. Then I have a long, skinny white pill and a long, skinny yellow pill. Which one are you talking about, baby? Does that sound familiar? I'd like to reiterate that my role is to help families navigate the healthcare maze, improve communication, support care coordination, and help make sure the standard of care is maintained for their loved one. I want families to spend less time overwhelmed by the system and more time being emotionally present with their loved one. Sometimes people do not need someone to take over the care. They simply need someone experienced to help guide them through it. This is where IHM Telehealth Family Care Health Navigation can help support families. I help coordinate appointments, communicate with providers. I help families understand discharge instructions, review medication lists for possible discrepancies, help organize questions to ask the doctors, help make sure specialists receive the reports they need prior to the appointment, assist families with navigating services and resources. Sometimes people try to search things online using AI tools for answers. And while technology can be helpful, it can also create more confusion when families do not fully understand the medical situation. My role is to bring clarity and organization while working alongside the family and healthcare providers. I am not trying to take over take over the care of your parent. I am not trying to take the place of the physician. However, I am a board certified nurse practitioner, which makes me qualified to help navigate care and explain medical diagnoses and treatment plans. I also can tell if certain things are contraindicated, and I have access to guidelines and resources. I am also a board certified case manager with over 14 years experience as a case manager. I've worked alongside many people within the state of Florida to help families get services that are needed when the insurance companies decline certain things. Maybe you need someone to file grievances or call and do a peer to peer on your behalf. That is the significance and the importance of having not only a board certified case manager, but also a board certified nurse practitioner because I have access. You don't need to wait and keep making another appointment and another appointment for for your primary care provider to help do things because he or she's only one person with limited support staff seeing patients every 15 minutes. Do you need help navigating the health system for your parent? What challenges are you facing? Leave a comment below.
Why does this feel like a fight? Who helps the family when the world starts falling apart? Who helps the daughter holding fear inside her heart? Trying to balance life and care, feeling lost and unprepared. Family care navigation, because no one should do this alone.
Book your appointment today. IHM Telehealth. We're here for you.